Hello, my name is Rashmi Patel. I'm a Senior Clinical Lecturer and NIHR Advanced Fellow in the Institute of Psychiatry, Psychology and Neuroscience at King's College London, and an Honorary Consultant Psychiatrist at the Maudsley NHS Foundation Trust. And I specialise in electronic health record data analytics with the CRIS tool. I've done a number of studies using CRIS to analyse de-identified electronic health record data to better understand clinical outcomes and the effects of treatment in people with mental disorders. The great thing about CRIS is the ability to analyse very large data sets in large sample sizes that are representative of real-world clinical practice. And to do this across a variety of different mental disorders, including not only information on demographics and things like age, gender, ethnicity, but also some more detailed clinical information that's extracted from the free text of the notes. The difficulty is free text documents are long, and if you were to do a study in thousands of patients, you might have millions of documents, and it would just be unfeasible to manually read through all of these documents. So that's where a technique called natural language processing, or NLP, comes in. And NLP is a type of artificial intelligence or AI method to automatically extract relevant clinical information from the free text of electronic health records. That's exactly what I've done with the CRIS system here to look at different symptoms of mental disorders. For example, the impact of negative symptoms in patients with schizophrenia. And I found that negative symptoms have a tremendous impact. They affect around half of patients with schizophrenia and are associated with greater risk of hospitalization and readmission to hospital. I've also looked at other factors such as illicit substance use and cannabis use and the impact that can have on treatments for psychotic disorders.
And how's your sleep at the moment?
More recently, I've looked at a range of different mental disorder symptoms, including symptoms of bipolar disorder, mania, depression, psychotic symptoms, in a large data set of people who present with depression, and found that patients with depression may not only present with symptoms of low mood and anhedonia, sleep problems, which are maybe the classical symptoms of depression, but they can sometimes experience other types of symptoms such as irritability, maybe elevated mood, and that may actually indicate a different kind of illness. And that may impact on the types of treatments that may be beneficial to patients. So the reason why all of this is important is the CRIS system now allows us to gather information that's not only in large sample sizes, but in great depth. And going forwards, hopefully that'll allow us to do research which is not restricted to particular types of patients, but actually more broader, looking at a transdiagnostic approach to mental health research, where we go beyond the diagnostic categories that patients might present with, to develop maybe more personalised treatment approaches so that we'll be able to assess patients and provide them with care that's more personalised based on their symptoms rather than just what diagnosis they have.